Everyone, Dr. Walker here, a chiropractor at Larimore Chiropractic and Massage. Today we're just going to go over a little demonstration of active release technique, otherwise known as A.R.T. I'm going to give a little demonstration here on Katie. Just going to kind of show you what you can expect on your first visit. A.R.T. is just a stretching technique. The idea is that we're trying to lengthen muscle, we're trying to reduce adhesions, and kind of strip out scar tissue. And I think the easiest one for us to do as far as a demonstration would be to use the upper trapezius muscle. Commonly tight on just about everyone we see in our office, and really common with desk posture. And so this is the muscle that kind of travels from tip of the shoulder, up the back of the head, across the skull, down the other side to the middle of your back. Big diamond-shaped muscle. So there are three general mechanisms of muscle injury. The first being acute trauma, this being sprains, strains, bruises, tears, the obvious muscle damage stuff. The second way that you can harm your muscle is repetitive microtrauma, this being repetitive bending of some sort, motions that you do at work repetitively, things that are going to slowly break down a muscle until it eventually tears. The third mechanism of injury is hypoxia, just not enough oxygen to the muscle. All three of those are going to leave you with tight, short, weak muscles. And so this is where active release technique comes into play. So for Katie today, we're going to do upper traps. So we're going to just kind of take a look here and see that right here, kind of right above your shoulder where everybody tends to hold their stress, is the upper trapezius muscle. And on her, it's not obscenely tight, but tight enough that it warrants some treatment. And so I just want to give you an example of what an active release technique stretch looks like. There's a general principle here that we're going to shorten a muscle. Origin and insertion are going to come closer together relatively. We pin the muscle down in that position, and then we lengthen the muscle. And that can be applied to any muscle in the body. But for ease of filming, we're going to do the upper traps. So let's start with you, ear to shoulder on your right side. Just lean in here. I'm going to pin the muscle down right where she sits. This is as short as her muscle can get. And then we're going to lean left ear to left shoulder. And just straight across, let it fall. And so what we're doing is not only are we stretching the tendinous attachments where this attaches to her skull and out to the tip of her shoulder, but I'm stripping out the belly of the muscle as well. This can leave you a little sore. Like as we can see, she's already getting red here. It's just part of the deal. It's usually like a workout kind of soreness. It's not going to be painful. Let's start right here. So we're going to kind of tilt her back like this. I'm going to pin the muscle down while it's short, and I want you to kind of drop your head past your left knee here. So I'll kind of guide you. Just drop right through there. Good. So feel a pretty reasonable stretch there, right?
Yes.
Perfect. Okay. So there are three planes of fibers in the upper trap. We're going to stretch all three. We've done the more lateral and the oblique. Now I'm going to get straight up and down here in the back. So to stretch the more vertical fibers of the upper trap, they run basically from here all the way up vertically to the base of the skull, and they're going to attach across this ridge. So the way that I like to stretch this is just to have her tilt your head back, look at the ceiling. Now this muscle is relatively short. The origin and the insertion have come as close together as they can possibly get. In this position, it's a little tough to see with her hair. I'm going to pin this muscle down. I'm going to really put some tension into it. Now you drop your head forward towards your lap. Just let that ride slowly towards your lap. And as she drops forward and the muscle lengthens, I'm lengthening downward even further. So we're stripping out the belly of the muscle. We're pulling this muscle off the one underneath, and we're stripping through any strands of scar tissue that have built up here due to overuse. And so she, for example, sits at a desk all day. This is killer for her. These muscles tend to be really tight and short, and doing this is quite a relief. So lean your head back one more time. Let's make one more pass. Drop your head forward. Just let's strip that out one more time. Perfect. And so you can see a little bit of redness. You're going to kind of light up a little bit. And this will maybe be sore for an hour or two. Something like drinking water, applying ice is going to prevent most of that. Minimal discomfort for the relief that you're going to get. And so that's kind of the general principle is we're going to shorten a muscle, pin it down, lengthen the muscle, and just try to overall reduce adhesions. And that's pretty much what you can expect the first visit. This is going to be your, this is going to accompany just about every adjustment you have here. And again, you can apply this to any muscle in the body. We can stretch things in the jaw, we can do things in the low back, legs, ankles, anything. So any kind of condition, A.R.T. is practical. and I think very useful and something that you'll probably get used to seeing every visit in our office.